Good morning, everybody. Dr. Brace here, and it's Facial Plastics Friday. Today I'm going to kick off a new series on rhinoplasty, and we're going to start this one off with a very specific nasal deformity, and it comes with an interesting story. So I saw this patient this week, and she was gracious enough to let me tell her story and share her photos. So the story here is that this beautiful young lady for her whole life has felt like she has not known how to breathe properly through her nose while exercising, specifically running. Every time she runs, she has trouble breathing. And she saw another surgeon who said that she had a deviated septum. And then she came in to see me for a second consultation to assess her nose. And it was very obvious to me from walking in the room and seeing her nose that her septum probably wasn't the main problem. It could have been part of the problem, but not the main problem because she has a classic nasal deformity. So I'm going to show a video here, and you'll be able to see sort of a pan around her face, what her nasal tip looks like, and you can see, and I'll zoom in here on her nasal tip on a freeze frame, that she has what we call a cephalic malpositioning or parenthesis deformity of her nasal tip. And you can see that it looks like there are parentheses on her tip, and this is formed from the tip cartilages, the lower lateral cartilages. When you see this, for all the surgeons out there, you have to be really worried about the nasal valve causing breathing issues, because it means the cartilages that normally support the nostril are absent. And then you can see now when she breathes in what happens. Her nose completely collapses. This is called external nasal valve collapse. And so this is a pretty common nasal deformity, nasal issue that gets missed by a lot of surgeons, because you look in the nose and you see a little spur or a septal deviation, and the person has a history of nasal obstruction, so you go right for that, fix it, and paradoxically the breathing can get worse. The reason being that if you've ever studied any physics and you know the fluid dynamic laws, that if you increase the flow of air in someone's nose, you're going to increase the negative pressure significantly. So by making more room for more airflow by doing a septoplasty, you may cause more collapse and more nasal obstruction. So really what has to happen in this surgery is that the nasal valve has to be supported with cartilage grafting. I can tell you I looked in her nose, and her nose looked pretty patent to me. There was no significant septal deviation. The big issue here is that her nasal valve is collapsing. So how do we fix this? This can be fixed with basically 3 different techniques and a combination of all 3 sometimes. But batten grafts, where you take septal cartilage or cartilage from the ear or cartilage from the rib, and you use that graft to support the area that collapses. It goes under the skin, but on top of the native nasal cartilages. You can use strut grafts and repositioning of the ala, or of the lower lateral cartilages. A strut graft would go underneath the native cartilage and provide support. And there are things like alar flaring sutures, where you use sutures through the septum and through those cartilages to flare them and give them more support. And sometimes these patients need a combination of all of those things. And so that is a nasal valve collapse. The number one reason why septoplasty surgery fails is because of there's failure to address the nasal valve. So for all you surgeons out there that operate on noses, make sure that when someone comes in with a nasal obstruction complaint, you assess their nasal valve, because simply doing a septoplasty may not solve the problem for them. And while you're doing a septoplasty and harvesting that cartilage, it's best to use it right away to support the nasal valve so that they don't run into recurrent obstruction or worsening obstruction. So I hope that was educational for everyone. Have a great summer weekend coming up, and happy Facial Plastics Friday.